Hello everyone. We recently developed an AI application to help caregivers navigate emotional challenges by helping them 1. Manage information overload, and 2. Address those who need to care for multiple patients simultaneously. We use the latest Gen AI speech-to-speech technology as well as integrating with our search AI platform Elastic to power this. As a caregiver, let's have a chat with our caring assistant now.
Hello, please provide me with the patient ID or name so I can assist you further.
Get patient 135.
Thank you for providing the patient ID. How can I assist you with Tana Hawk's care today? Is there a specific concern or question you have regarding his condition or treatment?
As you can see, after letting the assistant know the patient, the assistant did a function call to get the patient's profile that is linked to a hospital database. The function is specified and implemented by us, and the API that was being called returned the patient's profile, the name of the patient, the demographic, the medical history, so on and so forth. Obviously, when I interact with the particular assistant, I don't necessarily need to let the patient know, let the assistant know the particular ID. I also can let the assistant know the name as well. It is pretty dynamic. What is great after that was the assistant, after understanding the patient's profile, he was able to ask me whether there's any concerns depending on the prompt that I've specified. So obviously I specified to discover and understand the situation a bit more before giving me what I should do. So let me interact with the assistant even further. Patient is having problems and difficulty breathing.
I understand. Breathing difficulty can be concerning. Is the shortness of breath constant or does it occur during certain activities? Are there any other symptoms such as chest pain, wheezing, or increased coughing? Also, is he using any inhalers or medications to help with his breathing?
There's shortness in breath, there is chest pain. He's not using any inhalers or medication so far.
It sounds like the shortness of breath and chest pain need immediate attention. I recommend contacting his healthcare provider as soon as possible for an evaluation, as these symptoms can be related to his lung cancer or other health issues. In the meantime, ensuring he is in a comfortable, upright position may help ease his breathing. Is there anything else you've noticed or any other concerns?
As you can see, what happened with the assistant is that it's really trying to understand the situation a bit more. Internally, the model is trying to reason against one another with all the information that it's getting. So let me throw it off and ask it to sort of enrich it with my internal knowledge base. Please enrich with internal knowledge base and see what we can do.
Based on the knowledge base, here are some actions and considerations. Immediate actions. Contact healthcare providers immediately due to the presence of chest pain and worsening shortness of breath.
Okay, I'll mute this for now while the assistant continuously speaks this while I can talk through the entire process of what happened. So after mentioning letting the assistant know to enrich it with our elastic knowledge base, we did another function call internally to really enrich the experience using our internal knowledge base that is stored, such as very specific care instructions or some other additional medical research that we have stored within Elastic. The function or Elastic outputs very specific care instructions for us to take and send it over to the large language model and gave us a summary of what happened now. Okay, so let us end it off with the last prompt. Generate a summary of what happened.
Patient name, Tana Hawk. Patient ID, 135. Elastic Knowledge Base Summary. Contact healthcare providers immediately if rapid breathing, bluish lips, fingertips.
Okay, great. So what you can see is that the final report has been generated by our large language model. It has formatted the report nicely for me, the patient name, the ID, using our elastic knowledge base, the summary of what we should do, some of the very specific care instructions, and any information that you like. Obviously, you can even enrich it that whenever we interact with the assistant, it always needs to call our and enrich it with our elastic knowledge base. I just wanted to edit another flavor and an additional function call to our elastic vector database to really show you the experience of what's going on behind the scenes. It summarizes the problem and also gave me the recommendation of the entire of what I should do, especially with regard to Mr. Tan, the particular patient that I'm facing now, having trouble breathing. Okay, so all in all, what I've just seen is a very short demo of how we can leverage on the latest GenAI speech-to-speech technology, as well as Elastic, to help our caregivers navigate emotional challenges and ask questions on anything that they are facing today. Hope you enjoyed this demo. Thank you so much for your time.